Hi, everybody. Welcome back. I hope you're enjoying this summit. We have a very distinguished panel of experts up here to talk about patient stories. Because one of the challenges in cannabis that you have likely heard, or in CBD, is that everybody responds differently. Different cannabinoids work for different conditions in different people, different ratios. And so we found that it's of really the most sincere level of help to hear genuine stories of what worked for different people. So we have Leonard Lienau from Synergy Wellness, Dr. Alan Frankel from Greenbridge Medical, and Allison Attell from Treatwell Health, all CBD experts. Thanks for being here with us today, guys.
Thank you for having us.
So the format of this is to just go through different conditions and to pull from your database of experiences and knowledge some stories of what worked for different people and how did they approach that whole thing. And so let's start with the largest category, which is pain. And certainly there's a bunch of different kinds of pain, right? There's migraine and arthritis and chronic back pain and injury pain. So who wants to start with any of the stories that fall into a category in that domain?
We've definitely seen some really interesting results with migraines. What I really like about it is I'm noticing that there's a difference between females and males in how they're responding. We're finding that the females tend to be responding a little bit better to the higher CBD ratios, such as 20:1, where some of the males seem to be responding to 1:1. But there's also a difference between chronic migraines or actually situational migraines, maybe occasional ones. For example, we have one woman who is around 39 years old. She's a mother with 2 kids. She didn't want to have any psychoactivity, but she'd been suffering from chronic migraines for her whole life. She tried all other medications and nothing really helped her migraines. So we started her on a prevention plan, and her dose ended up being really working well with a 20:1, which was 5 milligrams 3 times a day. That was best for her. And hers tend to be triggered by some kind of stress sometimes. So if she knew she was having a stressful day, for example, she would add in a little bit more to her dose. Or we're also finding that CBDA seems to be working very well for certain migraine patients too. So if a patient's experiencing a migraine, you can actually take CBDA or possibly THCA, the raw acidic form of these cannabinoids, and it seems to take away the migraine very quickly.
So in just 5 milligrams doses, those are pretty low doses, right?
Pretty low doses.
Are you guys finding that as well with any of the pain patients you're treating?
Yeah, we have patients that respond to 5 to 10 milligrams 2 to 3 times a day. One of the interesting things is with neuropathic pain, that one of the new things we've become aware of is that age matters, that the patients who, the older they are, the more they can do with CBD only, which is very, very convenient. So depending what age they are, if they're 35 or 40-year-old, or if they're your typical, I mean, one of the most common form of neuropathic pain that I see is neuropathic pain from various chemotherapy agents like paclitaxel, Taxol. And there's one animal study that shows that if you take CBD at the time of administration of Taxol, paclitaxel, and several others, you can prevent the joint pain. Also, joint pains from the anti-estrogen medications, particularly tamoxifen, which is still used a fair amount, they get terrible joint pains that actually are treated very well with CBD without THC, but you can prevent them by treating it them early. It's hard and it's been incredibly frustrating to get oncologists to, I think this is a nice study that could be done. You take the next 100 people with breast cancer, they're pretty much all getting paclitaxel or Taxol, give 50% of them CBD and not to the others. But for both the joint pains and neuropathy from the anti-estrogens and the chemotherapy agents that are causing terrible, I mean, I see a lot of patients where their cancer has been gone for 5 to 10 years, and they're presumably in a stable remission, and their main issue is joint and neuropathic pain. And the longer they're out, it appears the harder it is to treat, which at least makes common sense. So one of the areas that we're really focusing on is pain related to cancer patients. I mean, the other pains that they have from bony metastases, generally we're using a 50-50 of CBD and THC, and we're starting to add both CBDA and THCA into those.
Interesting. Leonard?
Yeah, I would say pain is the biggest area that, if we had to look at all the different people coming into us, pain is the biggest group. And we did a study in the Bay Area Pain Clinic We use them a lot to track the pain. So they were coming into the office and reporting how well our products were working with them. 81.3% were having results, positive results from CBD and CBD THC ratios. I would say the best ratio that we've found is a 4-to-1 ratio, 4 parts CBD to 1 part THC.
Universally.
For pain.
For pain.
Yeah, universally for pain, both inflammation and neuropathic pain.
And what size doses were you giving people?
We always
suggesting?
We always start off small, so we might start with 2 to 3 milligrams 2 to 3 times a day, and have them go up until they hit one that works best for them. So we also have different strains, so we don't just work with the ratios. We have different tinctures made from different strains. I really like the tincture method, that model of taking it, because you can take 1 drop. You can even dilute that down and take a half a drop. But you know, they could take 15 drops or they could take 17 drops. They can really dial in the exact amount of CBD and THC that they're taking. So they have to find their dose, which is a titration process. We always start them small and have them slowly graduate up. And then we have different ratios, and then we have different strains. And the reason we go to different strains is we find that AC/DC, which is our most common 20-to-1 ratio product, sometimes in the daytime it makes people a little sleepy, lethargic, but Valentine X gives them more energy, and it's a different terpene balance. Valentine's doesn't have any myrcene in it, whereas the other one does have myrcene, so it's really good for sleep.
Have you guys found with the pain that there is more commonly benefits with a CBD dominant tincture, or have you found that it's more often a blend of a 1-to-1 or some kind of THC CBD ratio?
I've definitely seen the difference. I think all pain's not the same. So we found that certain ratios do seem to be treating certain types of pain very well. If it's more inflammatory based, then I really like the higher CBD strains, along with actually THCA. That combination is very powerful, we found, for inflammation. But also things like nerve pain don't tend to respond to CBD as much as THCA, which really seems to be targeting for a lot of these neuropathic sciatica type patients. And also combining that though with CBD brings it to the next level.
Yeah, with back pain patients, to me, we differentiated whether it's above the waist or below the waist. First of all, as far as success rate in treating back pain that's above the waist is much lower than treating it below the waist, where there's more of a neuropathic component. And I would say, other than patients perhaps above age 75 or 80, we still have the most luck with a 1-to-1 CBD THC strain, since or oil. And as far as sprays versus capsules, we pretty much always start with sprays, and then we gradually increase them as they need, and then we add up the milligrams, get an idea, and a lot of patients do better with capsules. And I think the hydroxylation in the liver, and probably 10 or 20 other changes that take place in the liver when you're taking it orally, actually are more effective for pain.
And this might seem like an obvious question, but if a dose isn't working, is the answer simply to titrate up? And if so, or not, how high do you see him going sometimes?
The obvious path that you would think is to go up, but that's not always the case. Sometimes lowering the dose, as Martin said, more is not necessarily better in this world. Cannabis, sometimes a microdose is better than a standard dose. But depending on the condition that they have, if they have cancer, we're up at the higher levels, what I call a macro dose. So it all depends on the condition. And somebody can find their dose and be really happy with that, go with that for a month or two, and all of a sudden it's not working. They build a tolerance to it, so they might need to take a tolerance break for 3 or 4 days, stop using everything, let the body reset itself. Another method is to switch to another strain, which has different terpene profiles, different cannabinoid profiles. The body will think, oh, this is a new thing, and it'll keep up there. or change the method that they take it. You know, a lot of times we'll combine using a vaporizer with using a tincture or capsules. The vaporizer gets them medicated right away, and then in an hour when the capsule's coming on, it takes on and keeps them at that level.
I think it also depends upon the area of pain in the body and what other diseases are going on. If you have somebody who has cancer and has pain and they have abdominal disease, we're going to go orally because going to the liver is beneficial, even though there certainly are issues with oral absorption of cannabis. We are actually working on some ways of changing the capsules to be acid-proof. There are certain oils that you can actually add to the extract that make the penetration into the lymphatics and the venous system greater so they get greater absorption. One thing, just as a general point, I think is helpful when you're giving capsules, even though there's MCT or another oil. I'm more of an oil fan than an alcohol fan, but if you're giving, even if it's a capsule that has MCT and cannabis oil in it, we'll have patients swallow it with a tiny sip of their least unfavorite oil. And we've not done blood measurements yet, but that's the next step. But as far as clinical responses, it definitely helps with acute and chronic pain. And actually, that's one other point. I think, at least in my experience, acute pain, somebody goes out and injures themselves and has a torn whatever, cannabis is not nearly as good for that as it is for chronic pain. I don't know why, but I don't think we've had very great responses for acute pain.
I might disagree a little bit with that, only because I'm noticing CBDA seems to be treating these severe pains really well, which is not quite what we expected, nor from you can see from the research, but observationally we've been using it for about a year now, and people that have had, say, torn ligaments or sprained ankles are responding very well to both CBDA and THCA for that sharp acute pain, where I agree with you, CBD does tend to be more on the side for inflammation and chronic.
I'm going to try that.
So it seems pretty universal, though, that you're saying that for most pain patients, with the exception of maybe some acute patients, a CBD dominant approach will have some measurable effect, right?
Yes.
Yeah, but I would still say statistically, for people with severe pain, they end up on some THC.
I agree, definitely.
And I think that's an important point, right? Because again, when there's this big kind of hype about CBD only, and yet I think pain is one of those examples where I usually hear, that's why it's surprising to hear even some of the larger ratios being the most effective approach. That seems like having some THC or even a balanced level of THC is the most effective approach.
We use a one-to-one probably statistically the most for, if you're going to ask what product we use the most for pain, it would be a one-to-one.
We've got 4,000 members in our collective, and we're known to be CBD specialists. So a lot of people come to us and they say, I don't want to get high. Maybe it's more effective, but I'm going to start with the CBD. And so we start them off at a 20-to-1, 25-to-1 ratio and see if that works. And if it doesn't, we'll slowly introduce some THC into the components. So like I say, 4-to-1 seems to be the most effective, but we're coming at it from the CBD side. Some people like to get high, and they go for the 1-to-1.
Well, and also, I think with pain, it's worthwhile noting that for whatever reason, it seems like when you have that kind of pain in the body, it definitely seems to mitigate the psychoactivity even with the THC, right? I mean, I've heard countless stories of people when they're not in pain taking a dose of some kind of THC CBD and feeling a little stoned, and then taking it when they're in some form of pain and not feeling at all stoned, just having the symptom relief. So have you guys noticed that as well, or is this just like a made-up thing?
Well, part of it, I think, is gratitude on their part. So they respond better, because even if they have, I mean, I had this one 83-year-old patient who was in excruciating pain from degenerative joint disease, and she responded great to a 20-to-1. I mean, that's all that she needed. We didn't have to go up at all. And she called me one day and said that her husband was insisting on her stopping it because of the giggling. And one time he forgot to bring her something. She thought it was kind of funny, laughed, and that was the end of her treatment. And she had to go back to living in pain because her husband was so upset about the psychoactivity, which is fear of psychoactivity is, I would say, the single biggest problem I have in my practice. Not the actual psychoactivity, because I mean, I've prescribed through my lifetime a lot of narcotics, a lot of benzos, a lot of medications that if I take, I feel really psychoactive from. And patients don't have a fear because it's pharmaceutical, it's safe, or they think it's safe. But a little tiny, tiny bit of psychoactivity will terrify people. And even with CBD, I used to get a lot of calls the day after people starting a 20 to 1, and they say, this was affecting me too much, and I was falling asleep. And what I call it is hyper-relaxation, that there are people, even if giving them 2 milligrams, 5 milligrams of CBD, that after the first, second, third dose, they do get this hyper-relaxation. And I think the reason for that is these people are exhausted. I mean, whatever's going on, they're tired, and CBD relaxes them, and they might take a nap. And they just have, I always warn them of this excessive relaxation, and some take it, it's, you know, it can be a little funny, but it's real. I mean, it's absolutely real, because it's such a change in the level of psychoactivity and their feeling from how they were before, where they're agitated and tight and in pain or anxious or other mood disorders, and now all of a sudden it's like they're melting. And you know, melting for a lot of us is a great feeling, but it scares them. And it always goes away after a couple of days.
I've had people say that even though it's 20 to 1, I'm feeling that it's psychoactive. And that word, psychoactive, you know, to me it means it's in the mind and it's doing something up here. But CBD does have a feeling. People think, oh, if it's not psychoactive, I'm not going to feel it at all. Actually, there is a feeling. I think it's, I agree with Alan, but I would word it differently. CBD is anti-stress medicine, and it's releasing the stress in the cellular level. The cells are just melting because the stress is being released. The if anyone's ever had kava kava, CBD is kind of like that. It's a body feeling. You feel it. I mean, if you take enough aspirin, you're going to feel it. So it does give you a feeling. It's hard to describe what it is, but it's a body relaxation feeling. And somebody could say, hey, I'm feeling stoned, but it's not, you know.
Yeah, that's their fear.